Okay, Assalamualaikum and good morning. So this is the first video for the topic of adrenal medullary hormone. So for this e-learning session, I will create a video for overview of this topic, and I will also include videos from YouTube that cover the important parts of this topic. So after this video, you will take a look at the videos from the YouTube that I included, and then proceed with the activity and assessment. Okay, so the learning outcome of this lecture is first state the hormones of adrenal medulla, describe the sympathoadrenal axis, describe the action and the effect of adrenaline, noradrenaline, and dopamine, and compare and contrast the cardiovascular actions of adrenaline and noradrenaline, and also dopamine as well. And also explain the clinical implication of adrenal medullary hormone secretion abnormality. So this is mainly about pheochromocytoma. So critical earnings. So in previous lecture, we talked about the adrenal gland and we talked about the adrenal cortex. So in the adrenal cortex, we talk about the mineralocorticoids, which is your aldosterone. And then we talk about your glucocorticoid, which is cortisol, and some of the androgens. So for adrenal medulla, which is the more center part of your adrenal gland, there are three main hormones that are secreted by the adrenal medulla. So there are epinephrine, or sometimes we call it adrenaline, norepinephrine, or we call it noradrenaline, and the third one, which is the dopamine, which is a relatively small amount when we compare to epinephrine and norepinephrine, but regardless, it is also a catecholamines that are secreted by the adrenal medulla. So as a whole, we call these hormones catecholamines. So the adrenal medulla, they are part of the sympathetic nervous system. So the secretion of epinephrine and norepinephrine and dopamine from the adrenal medulla is due to the stimulation of the sympathetic autonomic nervous system. If you remember from your second course, you know that the autonomic nervous system, the sympathetic nervous system, they will secrete norepinephrine at the postganglionic neuron. So this is the same norepinephrine that secreted by the adrenal medulla, but adrenal medulla also secrete epinephrine and dopamine. And as you can see here, majority are epinephrine and 20% from the adrenal medulla are norepinephrine. So as you can see here, stimulation from the sympathetic tract. So this is from your autonomic nervous system, or the stimulation from this thoracic splenic nerve. It will stimulate the adrenal medulla to secrete your epinephrine and also your dopamine. So if we look as a whole, so you can see here, it is part of the sympathetic division, the adrenal medulla. As you can see, they also same connection from the preganglionic neuron. And then they will release the hormone into the blood vessel. So if you want to consider it as a whole, you can consider adrenal medulla as one of the ganglion, rather than have a postganglionic neuron that secrete norepinephrine into the effector organ. The adrenal medulla release into the blood vessel. So epinephrine and norepinephrine, you know that they are sympathetic. So they are fight or flight. So this fight or flight also is part of when we are responding to stress. And when we are responding to stress, like we discussed in the previous lecture, steroid, cortisol, or glucocorticoids, they are also hormones that are released during stress. So all of these three, we mean the sympathetic nervous system, the sympathetic adrenal medullary system, and the cortisol from the hypothalamus pituitary adrenal axis, that release cortisol. All of these are released during stress. So your fight or flight mechanism, which is synonymous with your autonomic nervous system, it's also part of the stress response. So when you fight or flight, naturally you are feeling stress. So when you are feeling stress, then you have the noradrenaline, adrenaline, and noradrenaline from the adrenal medulla, and also the cortisol from your adrenal cortex. So this is the overall function hormone response to stress. So the effect of the adrenal medulla secretion of hormone with epinephrine and norepinephrine, they are similar to the one that are secreted through the autonomic nervous system. But the effects are longer because they are released to the blood. So they are in circulation longer when we compare to the release from your autonomic nervous system. So that is the difference. The rest, the effects are roughly similar. So what are the functions of catecholamines? I'm sure you have some idea because you already know about your sympathetic effect. So catecholamines, they causes these sympathetic effects, but from endocrine point of view, there are a few specific things that you need to know. So for epinephrine and norepinephrine, you know that they have adrenergic receptor. You encounter it a lot in your asthma, in your cardiovascular, when we talk about beta blockers, all of these drugs that affect the adrenergic receptor. And also we talk about your GI, right? Let's say your esophageal problem, you have all those adrenergic and acetic receptor. So for the receptor that causes the effect of epinephrine and norepinephrine, you have your alpha adrenergic receptor and beta adrenergic receptor. So alpha we divide into alpha 1 and alpha 2. Beta we divide into beta 1, beta 2, and beta 3. So all these receptors, they have different effect. So for alpha 1 receptor, as you can see here, most of them are the effect that you expect from fight or flight syndrome. So you have your pupil dilation, palate erection, your contraction of your intestinal sphincter and bladder. All of those you already know. But for this lecture, one thing that you need to focus is the effect on vasoconstriction, which is your blood vessel. For alpha 2, they have effect on neurotransmitter release. You don't need to know in detail, but you need to be aware that it affects insulin secretion. This when we talk about energy needed in response to stress. For beta 1, what you need to know at the main effects are for the heart. So you want to increase heart rate, which is chronotropic, heart contraction strength, which is inotropic, and although impulse conductivity, sometimes we call it dromotropic. So these three are the main effect of beta 1 receptor. For beta 2, if you can see here, the effect is vasodilation. So this is opposite of vasoconstriction of alpha 1. And we will go in detail. You can look in the lecture notes or from the videos that are included later. So you can see there's a different effect, vasodilation, vasoconstriction, and how this affect your cardiovascular function. And again, when we talk about energy, the important is your glucose. So you can see here, increased glycogenolysis and also increased glucagon secretion. So this is more about energy, about glucose level. And beta 3 receptor, we talk about lipolysis. So lipolysis, because this is similar to the cortisol effect. So previous lecture, we talked about how the steroid, the cortisol, they affect the lipolysis, the amino acids, all this distribution for energy. The adrenal medulla also have the effect based on the beta 3 receptor effect. So when we talk about the general effect of epinephrine and norepinephrine, so they will increase the basal metabolic rate. So for energy, for fight or flight, so increase metabolic rate, increase oxygen consumption by tissues, and this also accompanied by vasodilation, right? Because you want to deliver more oxygen to the tissues. That's why some of the effect of epinephrine and norepinephrine is vasodilation through beta-2 receptor. And then general effects on carbohydrate and fat. So this is the balance of energy like we mentioned before. So for the overall effect for glucose, when we have fight or flight, when we have secretion of epinephrine and norepinephrine, the overall effect is increased blood glucose level. So this, when we talk about, we talked before, the function of the receptor, glycogenolysis in liver and muscle increase due to the beta-2 effect. Decreased insulin secretion, this is alpha-2 effect, and increased glucagon secretion, this is beta-2 effect. When you learn about endocrine pancreas lecture in this course, you will understand more on how these are the one that involved in glucose control in our body. So when you learn about endocrine pancreas later, you also must remember that the sympathetic function and also the adrenal medulla, they also have effect on blood glucose level. And then epinephrine also causes mobilization of fatty acid from adipose tissue. So this is the lipolysis that we talked earlier. And this is the similar action as the glucocorticoids. And then also the epinephrine and norepinephrine also used as neurotransmitter in the brain. So you don't need to know in detail, but you just need to be aware. In our brain also, we have the beta-1 and beta-2 receptor and have a lot of function, particularly facilitate other CNS function and also arousal. So this makes sense, right? Because fight or flight, so you need to be aware, more alert, higher arousal. And the last one is dopamine. So dopamine, it effect on the adrenergic receptor, but they also have their specific receptor, which is the dopamine receptor, which is D1 to D5. When you learn in your nervous system, you know about Parkinson's disease, right? Parkinson's disease is something that affected dopamine. So there's a lot of these receptors in the brain. So as you can see here, D1 into D5, there's a lot of function, quite overlapping function in the brain. So for this function, for endocrine, you don't need to know. Just need to be aware that dopamine in the brain also secreted by the adrenal medulla. What you need to know for this course regarding the dopamine function is the effect on the blood vessel. So for the blood vessel, they have this D1 receptor that causes selective vasodilation, and then selective vasodilation to certain area which is in the brain and your heart and your stomach and also your kidney. So these are effect of D1 receptor, dopamine. So this causes vasodilation, even though we mostly associated catecholamine with vasoconstriction. And then another one that you need to know is dopamine effect on kidney function, because it is quite special, because epinephrine and norepinephrine, they have minimal effect on kidney function, but dopamine, they have effect on kidney function. So they have D1 and D2 receptor in kidney. So it affects the renal tubule and the collecting duct. And the effect is increased urine production, or we call it diuresis, and increased sodium content in the urine, which is natriuresis. This mostly because they increase renal blood flow in the renal vessel through vasodilation. So this go back to the effect on the renal artery vasodilation from the D1 receptor. So that's all for the overview of the function of the catecholamines. So the 4 videos that I included from YouTube. So you need to understand the norepinephrine effect on cardiovascular, the same with epinephrine and dopamine. So these 3 are the effect of the drugs of the physiological basis for the vasopressor that usually to treat shock. If you remember from your cardiovascular course, we talk about vasopressors as a treatment of hypotension or shock. So you need to understand the different effect from epinephrine, norepinephrine, and dopamine from the cardiovascular perspective. And then the last video is regarding pheochromocytoma, which is the abnormality of excessive secretion of catecholamine. And make sure you also take a look at the lecture notes because that will bind up all the information from the videos for the one that you need to know and help you in your exam. So thank you very much and make sure to attempt the assessment and complete the activity. I'll see you next time. Thank you.